Hi everyone, it's Dr. Campbell and I am back with another ICD-10 PCS Dissecting an Operative Report segment. Today we have a patient that has a preoperative and postoperative diagnosis of breast cancer. And the procedure that the provider is indicating that they're going to perform today is a Portacap placement. You know what I'm going to say. It's very important that you understand the procedure itself. As you know, I, as a visual learner, recommend that you actually get a picture of that particular device or procedure that is happening on today. So a Portacap is actually a device that is used to draw blood as well as give treatments such as IV fluids, drugs, or blood transfusions. And this port is actually placed under the skin, usually in the chest, and it is attached to a catheter, which is also known as a thin or flexible tube that is actually threaded into the large vein right above the right side of the heart. And as you know, right above the right side of the heart, that's where your superior vena cava is. This Portacap could actually stay in for weeks or even months. And so a needle is inserted through the skin into the port, and that's how the clinicians are able to draw blood or give fluids. So this makes sense that this patient with breast cancer is having this Portacap placed, because think about the fact that the patient perhaps needs chemotherapy or radiation therapy. And so one of the advantages of this particular device is that it prevents the patient from having to be punctured over and over again in the vein in the arm. All right, so back to our procedure. Now that you understand what's going on, as you can see, very, very important. So the patient was taken to the operating room and placed in the supine position. The right chest and neck were prepped and draped in the sterile fashion. Guys, nothing different. They're always going to provide anesthesia. They're always going to prep and drape the patient in the sterile fashion. The right subclavian vein was punctured and a wire was passed into the superior vena cava. Introducer kit was introduced into the subclavian vein, and the Portacap was placed through the inducer and by fluoroscopy was placed down to the superior vena cava. Let me pause for a second. I know some of you are like, oh, fluoroscopy, is that an endoscope? And the answer is no. The reason the answer is no is because fluoroscopy is a type of imaging. Look up fluoroscopy so that you can see exactly what it is. The pocket was then made over the right pectoralis major muscle superior to the breast, and the Portacap receptacle was placed into this pocket and tacked down. The catheter was then tunneled through this receptor. Hemostasis was achieved, subcutaneous tissue was closed, the skin was closed, and the Portacap was flushed with saline. So, this particular procedure relies heavily on you knowing what was done. Again, that visual is critical. And in this particular case, a Portacap was placed. So in the operative report, a device was actually inserted into the vena cava as well as into the subcutaneous tissue and fascia. Again, in order to understand every procedure that you're coding, you have to know about that procedure. So my root operation today is insertion of a device. and then my body part areas. So remember, I'm going to abbreviate. We had the superior vena cava, right? And then we also had the chest. So what's next, guys? Well, I know by now this is dissecting an operative report number 7. And so I know that you know that the next step is to go into our ICD-10 PCS manual. And our main term in the index is going to be insertion of a device. Now, because I know that I have the superior vena cava and I have the subcutaneous tissue fascia of the chest, I'm going to pick up both codes here. First, I'm going to go to the vena cava. Now, as you've learned thus far, the body parts under the main term or the root operation are divided along this first gray line. This second gray line is pertaining to the word under the first gray line. So just for example, not related to our scenario, but I want you to see this. Insertion of a device, acetabulum, first gray line, and then the second gray line is dividing your left and right. All right, so back to our patient. So our patient, it was inserted into the superior vena cava. And so I know, and what I'm going to do is I'm going to do what I know you guys are going to do. So you're going to say, okay, I'm going to go over and I'm going to look for superior. Okay, so that is subcutaneous. And after that, I see the letter T. So how come I can't find superior vena cava? Well, guys, what you have to do is actually go over to the letter V, and you're going to go to vena cava, and then superior gives you table 0 to H. Now remember, that fourth character is the body part of V. So just so we don't forget, let's go ahead and write that down. So that's table 0 to H. V. All right. Now, while I'm over here, I need to pick up that second procedure that was performed. And here, I'm going to go to subcutaneous tissue and fascia. And under there, I'm going to go to chest. And that gives me table 0JH. So like before, I'm going to write down my table 0JH, and then my body part was 6. So next step, I'm going to go over, here are my two tables, and let's make sure you guys can see this. So my two tables for insertion of the device, I have the insertion of the device into the superior vena cava, which is table 0 to H. And then I have insertion of the device into the subcutaneous tissue chest wall, table 0JH. All right, so you know the drill, guys. The next thing I have to do is locate my tables. And so I'm going to go over first to table 0 to H. And guys, did you notice? I just saw something as I was turning. You notice how this says continued? That lets you know that you're not at the beginning of your table, okay? So I'm gonna go, and I'm almost there. 0 to H. All right. So 0 to H, and remember, I have the fourth character of V, and so I'm gonna make sure you guys can see here. So the first row, there is no letter V. And so I'm going and I'm looking and whoa, there is a V. V is for the superior vena cava. So then the next question that I have to answer is, what was the approach? All right, guys. So in the report, it is noted that the right subclavian vein was punctured and a wire was passed into the superior vena cava. The introducer kit was introduced into the subcutaneous vein, and the portacap was placed through the introducer. So guys, this part of the procedure was percutaneous, okay? So then that is A3. And then the next question that you have to answer is, what type of device? Well, guys, remember I said from the onset, you have to know about your procedure. In this particular case, the patient is having an infusion device. Remember what a portacap is used for. So that's a 3. And then the last part, guys, is the qualifier, which there is no qualifier. All right, I'm going to use a different color here. So final code for the superior vena cava, 0 to H, and I'll move this up in a second so you guys can see, 0 to H, 3, 3, Z. All right, now we must do our procedure on the chest, and for there we were told to go over to table 0JH. Oh, look guys, something I mentioned to you earlier. 0JH, the page that I went to, it said continued. So I actually have to go down to the bottom of the previous page, and that's where it begins. This is important that you are able to see the entire table. And let me see if I can move my camera here. I want you to see how, let's see guys. All right, so I want you to see how on this side of the page, this is where table 0JH began, but then it continued on this side of the page. So it is very, very, very important that you are paying close attention. All right, guys, so now that we know we are at, let's bring the camera back down to get it in focus. So we know that we are looking at table 0JH, right? So now we have to pick up our fourth character, which we already know is a 6. So I want you to notice something. This is the beginning where insertion begins. And remember, we build our codes from left to right. Very important. Well, guys, here, I'm looking through these numbers. I don't see a 6. So that lets me know that I can't build my code from this portion of table 0JH. So I'm going to turn my book over to the next page, and here is where I see a 6. Now, what I'm going to do is just scan up and down this part of the book under body part to make sure that 6 wasn't listed in any other area. And so I've done that and I don't see it. So now I am here. So 6 is subcutaneous tissue and face, or subcutaneous tissue and fascia and the chest. Now, the next question that I have to answer is, what was the approach? Let's go back to our report. The pocket was then made over the right pectoralis muscle superior to the breast, and the portacap receptacle was placed in this pocket. So guys, think of a pocket on a shirt, and in this particular case, this is a pocket that was made on the chest wall to be able to sit that device down in there. They had to, store it somewhere in the body. So they made an incision into the chest to insert that device. So then that means this approach is open. Now, Oh, our device. This is the longest list we've seen thus far. And the question that we have to answer is, what type of device are we talking about that was put into the chest? And guys, again, it is critical that you understand what is going on. You have to understand the clinical aspects of these procedures in order to code them. There is no way around it, okay? So in this particular case, what we have is a vascular access device, totally implantable because they put it into the chest wall there. So that's going to give you a W. And then, guys, there is no qualifier. All right, so final code here is 0 J H 6 0 W and then a Z. All right, so those are your final 2 codes for this report. All right, guys. Well, Dr. Campbell signing off here. It's been a pleasure providing you with another ICD-10 PCS Dissecting an Operative Report series. Bye-bye now.